welcome back to another episode of the Breast Cancer Physio. I'm your host, Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode, we're going to be talking about a really common report that a lot of my breast cancer patients will talk to me about, usually a couple of months after their active treatment is finished. So this common report is rib pain. So what I'm talking about here is a little pocket of pain just at the base of the ribs, and it's usually on the side that radiation has occurred. So before we get into why I think this happens and what to do about it, if you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Give the video a big thumbs up and leave a comment in the section below if you have any questions on this video or any other topics around breast cancer. So this is a really common problem, and it often presents a couple of months after breast cancer treatment is finished, as I mentioned. And my belief or my theory as to what causes this rib pain is that it is the aftermath of radiation. I actually think this is the shadow of where the radiation is hitting, or just the tail end of the radiation, where it's catching those last couple of ribs. So even if you've had a mastectomy or if you've had a lumpectomy, this may still occur. The reason I suspect it is the radiation is because I've had plenty of patients where they've had a bilateral mastectomy, but this is only occurring, generally speaking, on the side the radiation has happened, and it seems like it's just close enough to the edge of the radiation that a little bit of that shadow of the radiation might be impacting this area. Now, to add to what this is, I don't necessarily believe it's rib stiffness, like the bone of the rib itself, that's being problematic. I actually think it might be the intercostal muscles between each rib. So intercostal muscles are the muscles that lie between each rib bone, and if they get tight, they can cause quite a lot of discomfort. So the good news is that this condition is treatable, and I generally find that when I have a patient that's talking about this problem and we treat it a couple of times, and I literally mean twice at maximum, usually this pain dissipates. But it's just one of those, another annoying niggle that breast cancer patients can be putting up with sometimes, and possibly not realizing that they're really not alone on this front, that it's happening to a lot of other people. So I really wanted to do a YouTube video on this topic, just again to reassure women and men that go through breast cancer treatment that get radiation, that rib pain through this little section may be quite normal for them in the context of the treatment they've just finished, and that it's very treatable. I have done another couple of videos on radiation fibrosis scarring. So just to sort of add a little bit more to this topic, there are a couple of videos. One, I'll put a link up here too, called How to Treat Radiation Fibrosis Scarring, because one of the most common problems following radiation, particularly if you've had a lumpectomy, is that breast pain can start and can persist because of the latent effect of the radiation treatment. There are definitely still people who have had a mastectomy who can also get thickening and tightening of the chest wall after radiation treatment is completed. So radiation fibrosis typically kicks in as early as 6 weeks, but more often than not, it's some months, like 6 months or more following the end of radiation. It doesn't happen to everybody, but it is very common. And I really like to promote the fact that this is quite a treatable problem. It doesn't necessarily completely dissipate, so the symptoms sometimes can still persist even with treatment, but you can certainly make the condition a hell of a lot more manageable if you get it treated appropriately. So if you're sitting at home and you've got rib pain and you think that this might be you, I would encourage you to try some soft tissue massage between the ribs. So if you literally just get your fingers and you just massage in between your ribs and just do pressure that you can tolerate first up, see if you can really focus on getting onto that little bit of muscle, because it's a very tiny space, as you can imagine. But if you can focus on getting in between the ribs and massaging that soft tissue, hopefully that is going to start to alleviate some of this discomfort. So if you are stuck at home, yes, I think it is very safe to perform this on yourself. and you would only have to perform this massage for say 3 or 4 minutes the first time and just see how you pull up afterwards. If you do a firmness that is tolerable to you, then that's what I would recommend. I wouldn't recommend going really, really hard through this area because you could make yourself sore, but super light massage may not be effective enough either, because generally speaking, if I'm treating any tissue that's been radiated, I'm going to try and push that tissue as firmly as the patient can tolerate, because I find that firmer scar massage is more effective than very light massage. So just keep that in mind, guys, when you are performing self-massage. If you do things too lightly when it comes to the effect of radiation, it may not actually be very effective. But at the same time, we want to make sure that you tolerate it, because I don't want people trying this and ending up in a lot of pain because they've pushed themselves too hard. So as you're doing this, just make sure that it is gentle to start with, but building up to firmer as you can tolerate. The other thing I should mention in this video though is if you do have rib pain that is unexplained, so if you haven't had radiation, or you're thinking that you've got rib pain that is not what we call mechanical, so if you don't get pain in a context where it's explainable, a lot of people would be worried about unexplained pains in the context of breast cancer. You might be worried about the cancer metastasizing to the ribs. You might be worried about new tumour growth. All of those things will naturally come to mind when you've got a pain that is new. But most of the time, the rib pain that's happening, 6 weeks to 6 months after radiation is most likely going to be caused by the radiation fibrosis effect. But if you are concerned about the pain and you want to clarify what the pain is, or at least clear the idea that there is any tumour growth in the area, the best thing to first do is to seek your medical team's advice. And if need be, they will go and do ultrasound scans, mammograms as required, MRIs and whatnot. I think the reason I can safely produce this video though is because this is a very common problem that is very easily treated if it's following radiation, but always be on the safe side. If you think this is an unexplained pain, then I would seek the advice of your medical team and get the appropriate investigations where you need to. The next best thing you can do, aside from trying some self-massage, is to book in with a physiotherapist who specialises in breast cancer if you've got access to one. I know not everyone has access to a physiotherapist, but particularly B, a physiotherapist who specialises in breast cancer treatment. So that's why I started this video talking about the self-massage techniques. The opportunity to go and see a physiotherapist who specialises in breast cancer is a really good one to take up if you've got access to them, because they will offer another level of reassurance, hopefully, that this is just radiation fibrosis scarring most of the time, and they will know how to get into those intercostal muscles and release that area. Again, this theory that it is intercostal muscles is just my clinical experience. I've done breast cancer work now for 7 years, and this area of rib pain is remarkably common, and just a little bit of soft tissue release seems to alleviate it. So it's certainly not something that is researched from my knowledge, but again, if this is occurring and it's got a really simple fix, and we can tie the two situations together whereby which someone has finished radiation treatment, 6 weeks to 6 months beforehand, it's highly likely just going to be radiation fibrosis. A good physiotherapist or any good health professional, medical professional, if the pain is not quite making sense to them from what we would coin a mechanical angle, then we are going to be referring the patient for further investigation. Like I said, there is unfortunate circumstances by which people do get metastatic bone cancer, and so we do need to be careful with unexplained pains, but I would certainly call this an explainable pain if you've had radiation treatment previously, and that it's just on the side of radiation treatment. The other thing to consider is rib mobility. So I think a lot of the time what happens is that after breast cancer treatment, patients will guard their chest wall. So if you've had a lumpectomy or a mastectomy, this is an area that has got scar tissue, so it's often tight, it's often lost muscle tone, so you might be weak through your shoulder girdle, you might have a tight shoulder because of protecting your chest wall. So at the end of the day, a lot of rib cage stiffness occurs off the back of that protection of the chest wall. So one of the things to also consider to get this rib pain, or what feels like rib pain, improving is to use a foam roller. So I've got a link to another video I did earlier on how to improve your posture after breast cancer, and this was all about how to use a foam roller to improve your rib cage mobility, because I think one of the biggest areas that's left untreated from a physiotherapy perspective after breast cancer is the rib cage and the upper back, which is called your thoracic spine. So the foam roller is used in my practice every single day to help breast cancer patients improve their shoulder mobility, neck mobility, mobility between their shoulder blades, their upper back, their ability to rotate, and even to take a deep breath. And as you can see, if you've got tension, even if it is muscular, around your ribs, if your ribs are getting tighter and stiffer, that's potentially going to make an impact on how well you can take a deep breath, which is then going to make an impact on how your cardio exercise might go in the aftermath of treatment. So have a think about that as well as a potential treatment option for this problem. Another thing I wanted to show you guys today was this wonderful book that I've just started reading, which is called The Exercise Prescription. So this is a book by Dr. Jonathan Herold and Dr. Dinesh Chowdhury. These guys have put this fantastic book together that is designed for anybody to read, and it's all about the benefits around exercise. But in particular, they have got a chapter that is dedicated to education on exercise and breast cancer. And one of the really cool statistics that I believe everyone on the planet should know, particularly people that have gone through breast cancer, is that there is research now to show that if you exercise on a regular basis, you are reducing your risk of a breast cancer recurrence by 40 to 50%, which is huge. So I'll talk a little bit more about this book in future videos because I think there is so much fantastic information in this book. I will definitely leave a link to where you can purchase the book in the description bar below, but I'll definitely be talking more on the information that's inside this book in future videos because I absolutely love this stuff. I think people who go through breast cancer really want to know every possible lever they can pull to reduce their risk of recurrence, and I think that the information on risk reduction through exercise in this book is particularly fascinating. So definitely get your hands on a copy of this. And I'll just give you a little hint that they really promote strength training, which is something I have been talking about ad nauseum on this channel for a little while. So definitely get your hands on a copy of this because it is fantastic reading. Thank you so much for watching this video, guys. I hope you've gained some great information on the topic of why do I have rib pain. I will be here next week again with another video for you. I hope you're having a great week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio, and I'll see you next time.